Alan, why is this course, CBT in Practice, important?
Judy, it's important, because that I have trained and supervised clinicians for many years, many times in formal training programs. And I've seen a lot of interns and postdocs and people early in their careers who have come to training and supervision and have told me, I've read about this, I've taken courses in it, I've even practiced what I've read. But many people have said to me, but I've never seen anybody do this stuff. And so the idea behind this is to take all of the main concepts of doing CBT, explaining them and demonstrating them so that people who take the course will be able to see firsthand what the words that we use mean in terms of how they're performed and what treatment looks like. Many people have never seen a full therapy session done. They've talked about techniques and have protocols and read the protocols, but haven't seen the whole sessions done. And as far as that goes, issues like setting the agenda or setting an action plan, quote unquote, everybody knows that you should do those things. Nobody has ever seen anybody do it, though. And so in this course, we are very clear and specific. These are the things that you need to do to set an agenda. These are the things that you need to do to set an action plan. And then we demonstrate how they're done individually, and we show them what it looks like in the context of a full session.
This course grew out of a project we did that focused on preparing clinicians for group supervision. Mm-hmm. I wonder if you can talk a little bit about why the course is important, even for people who aren't planning on having a term of supervision or may have already completed a term of supervision.
Partly because of my first answer, because it really shows people how what CBT looks like. But in addition to that, first for people who are preparing for supervision, it is a real guide for people who are going to take supervision to know just exactly what will be expected of them when they submit recordings of sessions that they do with clients. But people who are not going to be able to participate in supervision for whatever reason can still use this as a guide book for how you engage in the process of CBT. Again, we know about the techniques that have been demonstrated with their protocols, but the process of doing CBT. So people who have been exposed to CBT, perhaps they've taken our Essentials course, perhaps they've taken a course in graduate school and learned about the theory and the ideas, and they can even apply those to themselves. But at a minimum, they would understand the theory, the ideas, and if they like those ideas, they can take it one step further with this course and learn how to apply these when they're working with another person.
So can you say again for whom this course is appropriate?
This course would be appropriate for anybody who is interested in learning about CBT, about how to do CBT. That could be a graduate student. It could be an early career professional. It could certainly be somebody in a formal internship or residency program. Obviously, it would be helpful to people who are pursuing certification within Beck Institute. But other people who have maybe just questions about CBT, And we know that what some people's idea of CBT is different than what ours is. And I think that if they take this course, they will be able to see what the difference is.
Is it appropriate for people who don't plan to have 50-minute sessions with therapists? Would it be helpful, for example, to a medical professional?
You know, interesting question, because we have provided training to medical professionals, people who work in school districts, people who work in the correction settings, people who work in all different settings, or people who are just in business settings. And the value of this would be to show them how we adapt the theories and the ideas into practice. Now, some of the people are not going to use the elements of the course in exactly the way that we're doing them. But for instance, a medical professional, as you mentioned, medical professionals have very limited amounts of time in which to spend with their patients. Learning how to pace themselves, learning what are the important questions to ask, how to get to the point, how to manage their time, how to help get buy-in to developing their treatment plans, which are very important in the medical setting. So there would be some benefit for people from multiple settings. I would say that with this caveat, perhaps, that it's mostly going to be for people who want to use the techniques that we have and to use the process. I think that the Essentials course that we have is better for the ideas, the theory, and even using those things on oneself. So this would be primarily for people, including medical professionals, who would be working with other people and trying to use CBT to help other people achieve their goals and resolve their challenges.
Now, how is this course different from the Essentials course that we also offer?
Well, the Essentials course is based obviously upon the cognitive model, and it provides the history, and it provides the theory, and it provides the methodology, if you will, of how we conceptualize, how we think about things, and even help bring people to use some of those things on themselves. How this differs is what we're doing with this course is showing you how to use all of those when you're working with another person, as opposed to just, and I don't mean to minimize in any way, just the ideas, just the theory, because those are monumental in themselves. When you want to take those and work with another person, that's where this course would be most helpful.
And where do you see it falling vis-a-vis the Essentials course? If someone wanted to take both courses, where do you think they should start?
I think that they should start with the Essentials course. I think that provides the theory, the history. It provides the context in which everything in CBT is done. This in no way replaces that, and in my mind is not something that should precede that. I think that a person would take the Essentials course to get a really good understanding about CBT, and then this course would be more focused on how to work with other people, how to use the cognitive model to work with
CBT
other
in practice.
CBT in practice.
Exactly how to practice it.
Yes.
Yeah.